Assalamu alaikum wa rahmatullahi wa barakatuh, and good morning to Mr. Su, our lecturer for PBI 1092. I am Raul Rifaie bin Ronney. I am from this group consisting of Nur Adriana Athirah, Nurul Asyhira, Ladya, Sari, Binti, Johari. Our topic for the first assignment, which is information report, is types of anxiety disorder. So here you can see the diagram for this topic. So let's start. I am sure everyone in my experience have had a feeling of anxiety. Anxiety is common to everyone, no matter their age, old, young, rich, poor. Everyone experiences anxiety. It is a normal stress response in certain threatening situations. A helpful anxiety can be a source of motivation, such as during examination. It makes us think more and creatively and logically to find the answers. And also for survival, to make us think either fight or flight. However, there is a thing called anxiety disorders. This is where the anxiety is unhealthy and is interfering with our daily life and actions. It is described as having constant and distressing nervousness, worry, and maladaptive behavior. There are three common types of anxiety disorders. One, it is obsessive-compulsive disorder, or commonly known as OCD. Two, post-traumatic syndrome disorder, PTSD. And the third, social anxiety disorder, or SAD. This will all be discussed by my other members, and I give the mic to Adriana. Thank you.
Hi everyone, my name is Adriana, and today I'm gonna talk about OCD. OCD is one of the common types of anxiety disorders. What is OCD? From the word OCD itself, we can know what is the meaning of OCD. OCD, which stands for Obsessive-Compulsive Disorder, is characterized by the presence of obsessions and compulsions. Obsessions are repetitive and persistent thoughts that are intrusive and unwanted, which are commonly associated with anxiety. Compulsions are the repetitive behaviors or the mental acts that the individual feels to perform in response to an obsession to achieve a sense of completeness. What are the examples of OCD? The fear of germs or contamination by excessive cleaning or hand washing, the desire to have things symmetrical or in perfect order by ordering or arranging items in a particular precise way, or the fear of forgetting, losing, or misplacing something by repeatedly checking things. Wait, I always double check things, so do I have OCD? Nope. Everyone double check things sometimes, so how do you know if it's OCD? In general, people with OCD cannot control their obsessive thoughts and compulsive behaviors, even when they recognize those thoughts and behaviors as excessive. They also spend at least 1 hour per day on these obsessive thoughts or compulsive behaviors. They will experience a significant problems in daily life due to these thoughts and behaviors. So if you think that you might have these symptoms, run to the doctor, get a checkup. How do people get OCD? Genetics and environmental are contributors to OCD. That's all from me for OCD. Next, I will pass to Ladya.
Thank you to Professor Su. My name is Ladya Sari Binti Johari. My matrix number is 80656. It's an honor for me to share with everyone one of the type of anxiety disorder, which is post-traumatic stress disorder, or people call it PTSD. Post-traumatic stress disorder is a psychiatric disorder that occurs when people experience a series of extremely stressful events. These events usually happen unexpectedly. Post-traumatic stress disorder produces intense negative feelings of fear, distrust, helplessness, and horror in victims. In another sense, however, the mental and physical suffering in PTSD is beyond the range of normalcy and indicates a need for assistance. They often report feeling shattered, broken, wound, rip, or torn apart, like they will never get put together again. The intense fear and anxiety that accompany the event can overwhelm our ability to respond properly. Other symptoms include re-experiencing, avoiding, or feeling constantly anxious or worried. Although most studies of PTSD have been conducted in war veterans, several long-term studies have reported high incidence of PTSD among non-war trauma subjects. In addition, victims of domestic violence or sexual assault may also experience PTSD symptoms due to bullying they experience from peers. Being victimized also increases their chances of developing PTSD. Aside from trauma, other factors such as abuse, violence, and cruelty can also contribute to the development of PTSD. These can make it harder to recover from trauma and worsen the recovery process. Some patients also experience greater nightmares and flashbacks due to the stress from their lives. Most people with PTSD develop event-associated memories of being exposed to trauma. Combat exposure is also linked to an increased risk of developing PTSD. That's all from me. I will pass it to Nurul Asyhira.
Hello everyone, I'm Nurul Asyhira. Today I'm gonna talk about social anxiety disorder. Social anxiety disorder is the feeling of fright of social surroundings. I'm very sure that many of you don't know that there are many factors influencing social anxiety. One of them is negative core beliefs about yourself and others. For instance, the thoughts of being perfect and flawless all the time. Second factor is negative automatic thoughts when thinking. People with social anxiety disorder tend to assuming that something horrible is going to happen. Last but not least, anticipatory anxiety. Anticipatory anxiety is the feeling high levels of anxiety about things that has not happened yet. This kind of anxious feeling may be felt a month or weeks before the actual events and also may be felt for a long period of time, which can cause a severe stress. Apart from that, I'm gonna talk about social anxiety symptoms. First and foremost, emotional and behavioral symptoms. It is a fear of physical symptoms that may cause you embarrassment, such as sweating, trembling, or having a shaky voice. Next, physical symptoms such as trembling, upset stomach or nausea, and fast heartbeat. Lastly, avoiding common social situations like interacting with unfamiliar people or strangers, attending parties or social gatherings, starting conversations, and making eye contact. Alright, that's all. Now, I will pass back to Raul to conclude our presentation today.
Hello, back again. So to summarize, there are three common types of anxiety disorders as mentioned previously, and they are characterized as people experiencing distressing anxiety in specific situations. These people, those who are experiencing anxiety disorders, are unable to control the anxieties in said situations, and so they are in great need of help. And that encapsulates our topic for today, and I say thank you for listening. See you soon. Fare thee well.